we're going to be going through question preparation with GPhC style questions for the assessment. So in terms of the assessment, as you know, it's a two-part assessment. Paper 1 consists of 40 calculation questions. Paper 2 consists of 120 questions. 90 of those questions are single best answer questions. 30 of them are extended matching questions. One thing that I know people struggle with is preparing for extended matching questions. Did I get that right? Do many of you struggle with extending matching questions more so than single best answer? Because that's what we're going to, yes, we've got one hand raised. That's what we're going to focus on today. So 6 of the questions today will be extended matching questions. Today's session, we're solely focusing on infection. We'll make sure each webinar that we host moving forward from this will be dedicated. We'll have some dedicated sessions for each therapeutic area. And when it comes to the medium and low weighting topics, we'll group those together. It's just because when you're going through extended matching questions, if you have a good understanding of extended matching questions, you've got 8 options in terms of answers, and you'll have several questions relating to those options. So that going through that together, I presume, would be very time consuming. So we're going to go through mostly extended matching questions today, and then we're going to finish off with some single best answer questions as well. So we also have a giveaway from today's session. So all you have to do is take a picture from today's session, just take a snap of the webinar and tag MicroPharm on Instagram, and we'll announce the winner tomorrow night who wins the question pack. You can pick whichever question pack that's available that you would like to use. So let's start with the first poll. Question is slightly different on the poll, but essentially, how confident do you feel with your ability to answer GPhC style clinical questions, particularly in relation to the infection chapter? Most of you okay? No, let me share the results. Most of you are saying you feel okay, and a proportion of you not at all. It's about the right time to be thinking about questions and working through as many questions to help you prepare for the assessment. Of course, we'll support you with these sessions. And those of you who are members have access to 775 questions to prepare you for the GPhC registration assessment. So when it comes to extended matching questions, you'll get a theme for the question. So the theme for this question is infection and antibiotics. You will get 8 different options, 8 different answer options, and you have to select one of the answer that's most appropriate for the answer. And each option may be selected once, more than once, or not at all. So there's no reason for you to feel every single option has to be selected, or there's no reason for you to think that one option can't be correct more than once. Then leading on from this main body of the question, you will have several questions related to these 8 options. So we're going to start working through these questions, and you'll understand, if you haven't been through these types of questions before, you'll understand what I mean in terms of selecting the options. So this is the first question. This penicillin-based antibiotic is a good choice for skin and soft tissue infections, particularly those caused by Staphylococcus aureus, but it's not typically used for methicillin-resistant strains, MRSA. So which of these 8 options do you think is the correct answer? I'm going to now share the results because most of you have answered. Most of you answered D, flucloxacillin. So D, flucloxacillin is the correct answer. Why is flucloxacillin a better option? So when we're coming to penicillin-based antibiotics, which of our options are penicillin-based? First, let's go through that. You've got A and you've got D. I'm just going through it. Absolutely. A and D are your correct options when it comes to penicillin-based antibiotics. Why would you rather go for D rather than A? Why not amoxicillin? Coverage, yes, but it's something more than coverage as well. So flucloxacillin actually has a relatively narrow spectrum of activity, which is good. But there's another problem as well. I've mentioned it in previous webinars. So they're both active against Staphylococcus aureus. Feel free to share your answer to everyone rather than direct message because you're actually right. So I presume you sent it directly because you were like sure if it's right. Absolutely right. So Vion said resistant to beta lactamases. So Staphylococcus aureus produces this enzyme called penicillinase, and it's a type of beta lactamase. And what it can do is it can break down the beta lactam ring. So it's becomes Staph aureus. Most strains of Staph aureus have developed resistance to amoxicillin. Now, flucloxacillin is actually very stable when these penicillinases are produced. It actually isn't broken down easily by these penicillinases. And that's why flucloxacillin is still a good option for treating Staph aureus or skin and soft tissue infections when amoxicillin is not working. So that's what makes it quite useful. Now, let's move on to the next question. This is an antibiotic that's effective against anaerobic bacteria and certain protozoa, and it's commonly used to treat bacterial vaginosis, trichomoniasis, and infections of the gut. 60 of you have answered so far. 60% of you have answered so far. Almost 80% of you. Let's share the responses. So the large majority of you, 87% of you, have popped as the correct answer, which is metronidazole. And that's right. Metronidazole is the right answer for this. So there's a few things that are leading to you picking metronidazole. First of all, it's saying it's effective against anaerobic bacteria. So that's metronidazole only has activity against anaerobic bacteria. That makes it quite useful for when you have an infection caused by anaerobic bacteria. You also have got the information that it's active against certain protozoa, and that's what makes metronidazole unique, its activity against protozoa. The other thing is with regards to bacterial vaginosis and also infections of the gut, this tends to be caused, particularly infections of the gut, tend to be caused by anaerobic organisms, and that's what makes metronidazole a useful agent for infections caused by anaerobic organisms. So that's correct. Metronidazole was the right answer for question 2. This is question number 3. A broad-spectrum antibiotic used for atypical pneumonia, and its distinguishing feature is that it should not be used in children under the age of 12 or in pregnant women due to the risk of teeth discoloration. Okay, let's share the answers for this. So that's correct. Most of you have popped down C, which is doxycycline. Doxycycline is the correct answer. Doxycycline is a broad-spectrum antibiotic. It has activity against many different organisms. Its usefulness is the fact that it does provide coverage against atypical organisms. So this is quite useful for doxycycline. Even ciprofloxacin has activity against atypical organisms as well from these options. We know from its distinguishing feature, it's contraindicated, not don't like to. It's contraindicated for use in children under the age of 12 and pregnant women, and this is due to the risk of it can cause teeth discoloration. So this is something to take into account. Moving on to the next question. Let me relaunch the poll. Antibiotic that is not absorbed when taken orally and is given via parenteral routes. It's known for its serious side effects of nephrotoxicity and ototoxicity, especially when administered in high doses or for prolonged periods of time. 75% of you answered so far. Let's share the results. So everyone here has answered E, which is gentamicin, which is absolutely correct. So gentamicin is considered a high-risk antibiotic, has a narrow therapeutic range, and one of the things that's unique about gentamicin is it can cause nephrotoxicity and ototoxicity. The nephrotoxicity is reversible, the ototoxicity is irreversible. So it's very important to be mindful of the ototoxicity associated with gentamicin use. What drug class does it belong to? Aminoglycosides. Yes, aminoglycosides. Someone asked the question as a direct message, what if there was an option for vancomycin 2, which is very good. It's a very good question. That's exactly the reason why I did not include vancomycin in this question, because you have not got enough information from this question to distinguish between the two, because they're both not absorbed well when taken orally. I know you may be thinking about the fact that vancomycin is given orally for C. diff. Does that mean the statement it's not absorbed well when taken orally is incorrect for vancomycin? What do you think? Let me know. No, exactly what Ahmed said, and I can see what you're reaching for. So it's both are not absorbed well when taken orally. I don't know what happened to my voice there. Both are not absorbed well when taken orally. And that's the reason why you'd give the vancomycin orally for C. difficile. Because it's not absorbed well from the gut, it means it's more likely to stay in the gut and have its effect in the gut. And the C. difficile organism is within the gut, so it can work really well locally. So that's something to take into account, so that both of these options could be either vancomycin or gentamicin. Can you do anything to help with the ototoxicity? So the primary thing to do with regards to ototoxicity surrounded with gentamicin use is to stop it, because of the fact that if the person's deaf, can someone else chip in about if the person's deaf? Can someone else tell me their knowledge of this? Because you should already have covered, some of you may have already covered this when learning it. Anyone? What if the patient's deaf? What do you think? No, let's still focus on the ototoxicity. If the patient has any auditory problems, it's already cautioned for use. So there's already a caution of whether or not it be, basically you shouldn't be using it with anyone with, ideally you shouldn't be using it with anyone with auditory problems unless you absolutely have to. That's the first thing. The second thing, with regards to steroid use, there is some limited evidence that dexamethasone in particular can be used to mitigate the side effect. It's only used to mitigate the side effect. Any damage that occurs as a result of gentamicin use is irreversible. But when it comes to managing the ototoxicity, you're absolutely going into the realm of it's not going to come up in the exam. So you can go through that for your own understanding, but you're delving into highly specialist areas. Back to what I said with regards to the auditory problems, it's definitely a caution, not a contraindication. The only time where it's contraindicated for use is if the person has a perforated eardrum or the patient has a grommet. Does anyone know what a grommet is? Some of you may have had your own grommets inserted. So it's actually like a small piece of tubing that sits within the tympanic membrane, which is your eardrum. And the reason for it is for drainage of fluid that can build up in the middle ear. That's quite often what occurs in otitis media. When patients have otitis media, have a buildup of fluid in the middle ear. If you're having problems with treating that, patients will have a grommet. So those are the circumstances where it's contraindicated. But auditory problems, it's a caution. Let's move on to question number 5. So let me read out the question. Sorry if you can't see it properly. A fluoroquinolone antibiotic that's often prescribed for urinary tract infections and also effective against gram-negative bacilli. Caution is advised with patients with a history of tendonitis or tendon rupture. Okay, let's share the answer for this. So it looks like the large majority of you have put down question answer B, which is ciprofloxacin, which is absolutely correct. Ciprofloxacin is an example of a fluoroquinolone. What other examples of fluoroquinolones exist? Absolutely. Levofloxacin, you may come across ofloxacin as well. With regards to ciprofloxacin, one thing that's important to consider with regards to ciprofloxacin is the fact that it has great activity against gram-negative organisms. And levofloxacin has great activity against gram-positive organisms. Where are both of these antibiotics used in contrast to each other? Levofloxacin, quite often you will see it used for respiratory tract infections, and that's because of its great activity against Streptococcus pneumoniae and Staphylococcus aureus. Ciprofloxacin, quite often you will see it used against for infections caused by gram-negative organisms. And this is urinary tract infections. Quite often you will see urinary tract infections like caused by E. coli, more complicated cases caused by Pseudomonas. Pseudomonas, of course, and E. coli are gram-negative organisms. One thing that you also know from this question is it's advised for patients with it. It's advised to not be used, ideally, in patients with tendonitis or tendon rupture. There's a caution for its use if they've ever had tendonitis or tendon rupture before, not as a result of ciprofloxacin use. If they've ever had a ciprofloxacin or another fluoroquinolone before and they've had tendon damage associated with that, absolutely contraindicated. Let's move on to question number 6. We've got this question and 4 more questions to go in total. But as I expected, you can see how time consuming it is just to go through one extended matching question. 22-year-old, sorry, I should have read that. 22-year-old female patient with dysuria, frequency and urgency, has a history of 3 or more episodes of cystitis in the past year, not sexually active. What is the most appropriate antibiotic for lower urinary tract infection? For this, let's just consider the fact that you've got no evidence of a history of resistance with this patient. If that helps, let's share the answers for this. So absolutely, the correct answer for this patient is trimethoprim. One thing to take into consideration with this patient is with the amount of urinary tract infections that this patient is experiencing, it may worth delving into it a bit deeper, just from a understanding of the question perspective. It may be useful for this patient to be on prophylactic antibiotics, but there's nothing stopping you, particularly if you've got no evidence of resistance, stopping you from going for the first line for this patient, which is trimethoprim. From these options, so if what other option could be on this list that would maybe more, which may be more useful than trimethoprim, given the current climate? Nitrofurantoin. Why nitrofurantoin, given the current climate? Less risk of resistance. Resistance for trimethoprim is extremely high nationally. It's 1/3 of patients that present with E. coli have demonstrated, the E. coli has demonstrated resistance to trimethoprim. So in some regions, it's 42% of E. coli organisms demonstrate resistance to trimethoprim. And that's why nitrofurantoin would be a better option, but you don't have it in these options that are in front of you. Okay, moving on to the next question. Let's go through some single best answer questions. So, an antibiotic that is often combined with clavulanic acid to extend its spectrum of activity against beta-lactamase producing bacteria. Which one is it? So, single best answer, more than one option may be correct in some circumstances, but it's the most suitable option that you should go for. Doesn't always have to be the case. Okay, let's share the answer. 100% of you have put down A. That's correct. Amoxicillin is combined with clavulanic acid to give you coamoxiclav. In the coamoxiclav, the clavulanic acid is a beta-lactamase inhibitor and allows the amoxicillin to work and inhibits beta-lactamases that are produced by bacteria. Let's go to question number 2. Which antibiotic from the list is a tetracycline? Should be used cautiously in sun-exposed situations due to the risk of photosensitivity. Okay, let's share the answers. The correct answer for this was C, doxycycline. Doxycycline is the only option that you've got here that is a tetracycline antibiotic. And one thing that you would advise patients to do is use sunscreen with a high sun protective factor and and also to have long sleeve clothing as much as possible. Someone asked a direct message, would the actual GPhC exam have questions worded this simply? So with the GPhC exam, you can have a combination really. If you look at sample questions, some sample questions are very wordy, give you a past medical history and a medication history for some questions, and some questions will be very straightforward like this. There is essentially a mix between the two. Many questions will take you less than a minute to answer. Some questions will take you 30 seconds to answer. Some questions will take you 4 to 5 minutes to answer. So when you are splitting up your time, always take into consideration that the amount of time you have per question, which is approximately 2.5 to 3 minutes per question, regards to the clinical paper, I was referring to the calculations, but some questions will take you a few seconds to answer. Some questions will take you a few minutes. It tends to balance out with regards to the average time that you're spending per question, if that makes sense. So there are some questions that will be as straightforward as this. If we get a chance at the end of the session, I'm more than happy to pull a few sample questions that look similar. While you're working through here, I'll pull some up. Okay, so antibiotic interferes with bacterial DNA gyres, making it more effective for the treatment of traveler's diarrhea. Okay, I've got some examples to show you for the person that asked me. Please, for those of you who have time, you can stay at the end and I'll go through some sample questions to give you some familiarity of what these sample questions could look like. Oh, I moved on to the next question. Let's share the answer. The correct answer is B, ciprofloxacin. So this is the only option that has an impact on the bacterial DNA gyrase. I think the thing that confuses people is ciprofloxacin's use in traveler's diarrhea. So yes, ciprofloxacin can increase the risk of C. difficile, but it's still effective against traveler's diarrhea. So traveler's diarrhea and C. difficile are vastly different with regards to how they present themselves and the bacterial causes. So yes, there's a risk of C. difficile with ciprofloxacin, but that doesn't rule it out as a useful agent for traveler's diarrhea. So that's one of the things that people can find challenging, but it is indicated for traveler's diarrhea. This antibiotic is used for the treatment of acne vulgaris, and it's particularly effective due to its anti-inflammatory properties and action against Propionibacterium acne. Let's share the answer here. So the correct answer for this was C, doxycycline. You will see clindamycin used, but it would often be used in a combination with other agents, in particular with tretinoin or isotretinoin, as a topical preparation. But those are, in terms of monotherapy and used for acne with anti-inflammatory properties, that's against P. acnes, the most appropriate would be doxycycline. Okay, so this is the end of our questions for today. I will go through some sample questions with any of you. Just we do have our free calculations course. So the free calculations course is on the MicroPharm website. I need to run a poll right now. Just bear with me about how you found this. Stop sharing that. Okay, we pop some useful links in the chat. If anyone wants to have of anything that MicroPharm offers or some advice leading up the assessment, drop me an email today at info@micropharm.org. I have time and I'm in the office until 7 p.m. today, so more than happy to have like a catch up with anyone that will find it useful.